All right, today we're going to talk about what to expect with meniscal surgery. Meniscal surgery is the meniscus, which is the big cartilage in between the bones. And Mark is going to be our model here. We can see that looking at this model and looking at the actual knee, we have a thigh bone here, which is called the femur. We have the leg bone here, which is called the tibia. And in between the bone are these two big white structures, which are called the meniscus or menisci. And you will have one meniscus on the outside of your knee, and you have another meniscus on the inside of your knee. And this is a common structure in the body that's unfortunately torn and gets injured in young patients and in older patients alike. When the meniscus tears, it can cause pain, swelling, and instability, and often a procedure such as a knee arthroscopy needs to be performed to help the patient eliminate their pain and return to a good functional level so they can get back into their regular activities and sport activities. All right, after you go home from knee arthroscopic surgery, this is what to expect. You're going to have some pain, you're going to have some swelling, but typically this is fairly well tolerated. You may use crutches, cane, or a walker for a few days just to get your balance, but typically most patients are walking reasonably well in 1 to 2 weeks. The stitches, which are going to be on the outside and on the inside part of the knee, will be covered with band-aids on day 2 after your surgery. When you go home, you'll have a big bulky dressing with an A-strap and gauze that can be removed. And then when you shower, you can simply cover the incisions with 2 band-aids. One over here, and similarly, another band-aid on the inside of your knee. After this is covered, you can shower normally and you can get the incisions wet. We don't want to soak it in a tub or submerge it in a pool, but you can certainly shower normally. After you're finished showering, you simply change the band-aids. We will see you in the office at 2.5 to 3 weeks to have the sutures removed. As far as pain medication, you may often take some pain medication for a few days that we give as a prescription, but simply Advil, Aleve, or Tylenol may be effective in controlling the pain after surgery.